According to a recent CDC survey, 1 in 25 hospital patients has at least one healthcare-associated infection, HAI, and approximately 75,000 patients with HAIs die each year.
The potential for problems when patient safety protocols are not properly followed are tremendous. And education plays a critical role in assuring that the staff of an institution knows what they need to do to keep a patient safe.
Continuing education is not new. It helps medical professionals stay up to date on new developments and improves patient safety.
The hospital and many healthcare facilities are considered therapeutic environments, but built into many of the procedures that are performed are inherent risks. And really, one of the best ways to address these types of risks is to educate staff as to how to best prevent them from happening.
Physicians and medical professionals have to take continued medical education courses for safe practices, for state and federal medical licensure, and also for facility-specific reasons, and following the current trends of medicine.
Staying on top of continuing education requirements has been time-consuming and fraught with challenges for both healthcare professionals and medical facility administrators.
Managing such a large staff of medical professionals is a daunting task. We need for them to be 100% compliant with state and federal regulatory institutions that mandate these required trainings. Having pieces of paper flying around just makes it impossible for us to track exactly where folks are in their process.
Sometimes going to live courses can be tedious and very, very long. Some of the courses can be 8 to 10 hours. I find that my attention span does not last that long. It's hard for me to retain all the information from various speakers. Also, some speakers are not as engaging to listen to as others.
Technology is changing the way training and education is developed and delivered.
With nearly 6,000 active medical professionals in our institution, using an online platform gives us the scalability and the flexibility that we wouldn't otherwise afford if we were using a paper process.
What sets apart online training from conventional methodologies is two-sided. There's the user perspective and then there's the administrator perspective. From the user perspective, the convenience of it.
I enjoy taking medical education courses online. I'm able to take them in the privacy of my own home or office on my own time, and it's a lot easier to squeeze them into my busy schedule.
From the administrator perspective, you can have instantaneous reports of compliance so that when regulatory authorities ask for proof of compliance, it's right there, it's immediate.
Having the capability of knowing exactly how well our medical staff scored on specific training modules gives us the ability to know how close we are to our goal of keeping our patients safe. And it allows us to focus on specific areas where we feel there's greater need for attention. It's definitely something that we wouldn't want to do without.
ProCEO develops, delivers, and documents high-quality continuing education online for medical organizations. ProCEO provides required and up-to-date educational programs to professional staff through a proprietary learning management software system known as OSCAR.
Our OSCAR online learning management system is a full suite, end-to-end solution for hospitals that need to train medical staff on a regular basis in a very cost-effective and efficient manner. It also has an administrative component where individuals who are charged with monitoring compliance with educational requirements are able to run reports and get information in real time and have the documentation available to them so when inspection authorities come in, like a State Department of Health, they can easily provide this documentation to the inspector.
ProCEO creates customized content that is branded with the organization's look and feel and provides complete customer support around the clock.
What sets us apart from other companies is that all of our education projects are managed by health professionals. And health professionals understand the environment and they understand how to make the presentation meaningful for the intended audience of our client.
I recently took a ProCEO CME course online, and the information was very well organized. It was very easy to follow. I was able to retain the information very well, and it was very cost effective for me.
Find out how ProCEO can help meet the education needs of your professional healthcare staff. Visit ProCEO online at proceo.com.